Hello and Assalamu alaikum. I am Sadam Ishaq from GMM 28, 4th semester. Today I am going to do a short video lecture on the topic of antihyperlipidemic drugs. As we know, in this modern world, vascular disease is one of the most common cause of death. That includes arteriosclerosis and some other pathological disorders like that. Recognized major causative factors that causes these complications are smoking, stress, and diet. These complications are treatable and can be treated by medications or by surgery. That depends on the complication or condition. Actually, a hyperlipidemia is a major indicator or suspected cause of the arteriosclerosis that may caused by disease of liver, kidney, pancreas, thyroid, or any other unrecognizable or undiagnosable conditions. Arteriosclerosis is a buildup of a fat, cholesterol, or any other substances in artery wall and forms a plaque there that will leads to the blockage or to produce a resistance in the flow of the normal blood in the vessels, and this can affect anywhere in the body. Antihyperlipidemic agents, drugs, are actually a diverse group of the pharmaceuticals that are used in the treatment of high levels of fat, cholesterols in the blood. So here, this is a classification of different antihyperlipidemic drugs. The first one is HMG coenzymes A reductase inhibitors. That includes rosuvastatins, atorvastatins, pravastatins, lovastatins, and etc. As you can see in the examples box. Second one is the fibric acid derivatives. That includes clofibrate, fenofibrate, benzafibrate, fluvastatin, ciprofibrate, gemfibrozil. And third one is bile acid sequestrants. That includes cholestyramines, cholestyramine. Fourth one is aldehyde oxidation inhibitor. That includes propiocol. And fifth one is pyridine derivatives. That includes nicotinic acids, nicotinamides. And sixth one is the cholesterol absorption inhibitors. That is ezetimibe. Seventh one is miscellaneous agents. That includes beta cytosterol, dextrothyroxines. Here you can see clofibrates and its structure, which is a fibric acid derivative, and this one is a lovastatin, which is an HMG coenzyme reductase inhibitor. Here is cholestyramine. This one is cholestyramine hydrochloride. So here we will see mechanism of action of HMG coenzymes inhibitor. You can see it works by two ways: by the inhibition of HMG coenzyme or by increasing the LDL receptors. Further, we will see its mechanism in this picture. As you know, HMG is 3-hydroxy-3-methyl glutarol coenzymes A reductase. This enzyme facilitates the rate limiting step in the cholesterol synthesis, and inhibition of this step will definitely decrease the synthesis of cholesterol. Then New depletion of cholesterol causes the cell to increase the specific LDL receptors that can bind and that can internalize the circulating LDL. Thus, end result is reduction in the plasma cholesterol. LDL is low density lipoprotein, sometimes that's also known as bad cholesterol, and its increased level in our body will lead to the different pathological conditions. Here it's a mechanism of action of the fibrates, phenofibrates, fibrates, and benzafibrates. These drugs lower the serum level of low density lipoproteins, triglycerides, and increases the high density proteins. Peroxisome proliferate activated receptor or PPAR are a nuclear receptor that regulate lipid metabolism. Fibrate triglycerols binding to these receptors result reduction of the concentration by increasing the expression of lipoprotein lipase. They are used in the treatment of hypertriglyceremias. As you know that HDL stands for high density lipoproteins and also known as good cholesterol because it takes cholesterol from the different parts of the body to the liver, and then liver makes its pathway to go out from the body. Drug agents belonging to the fibrates bind to the peroxisomes proliferating activator receptors PPAR that regulates lipid metabolism. Fibrous binding to these receptors results in the decrease of LDL concentration and triglycerides, and by increasing the concentration of lipoprotein lipase. These agents are useful for the hypertriglycemias treatment for mean of to lower their elevated levels and to make it normal. And here is the summary of these all mechanisms that we have seen in the picture. So let's move on. Here is a mechanism of action of bile acid binding resins. Cholestyramine and cholestyramine are the significant low density lipoproteins cholesterol lowering effects or agents. These agents are actually resins that can bind bile acids in the intestine, forming insoluble complexes that excretes in the feces. Lowering bile acid level will triggers the conversion of the cholesterol into the bile acid, and the end result will be a reduction in the cholesterol concentration. And the last one is the mechanism of action of cholesterol absorption inhibitor. Drugs belonging to this category will inhibit the intestinal absorption of the dietary and biliary cholesterol in the small intestine, results in the increase in the clearance of the cholesterol from the blood. I hope this video will be helpful for you, and thanks to all for your attention, and especially thanks to the Sir Abdullahi for providing me this opportunity. Thank you so much. Goodbye.